So this is a really special population of cancers that might be uniquely responsive to treatment.
That's Dr. Mariya Rozenblit from the Yale School of Medicine. She'll be back later in the show. Today, a new registry study for a rare form of breast cancer. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. De novo oligometastatic HER2-positive breast cancer is a rare form of the disease that's already in stage 4 when it's diagnosed. This group of patients is unique because their disease is very responsive to treatment, making possible long-term disease-free survival. A new registry study out of the Yale School of Medicine evaluates patient outcomes to better understand treatment planning. Our guest today is here to tell us about the registry trial. Dr. Mariya Rozenblit is a medical oncologist specializing in breast cancer and an assistant professor of medicine at the Yale School of Medicine.
I only see patients with breast cancer, and my research interest is pretty broad, but I'm very interested in young women and trying to figure out why young women tend to develop breast cancer that can be a little bit more aggressive, as well as looking at different types of breast cancer and doing translational studies to try to find biomarkers to see if we can find better treatments and improve on the current treatments that we have right now.
Will you tell us about the basics of this disease?
Yeah, so let's break it down word by word. So oligometastatic means that it's breast cancer that has spread to other parts of the body, most commonly lung, it can be liver, it can be bone. And oligo means it's only a couple of lesions. So usually less than 5 is something that we would consider oligo. And then HER2 is a type of breast cancer that we see. So it's a receptor on the outside of the cancer cell that is the main driver of cancer growth. And we categorize it together as HER2 positive breast cancer because we have specific treatments that target that HER2 receptor.
How many people are diagnosed with it each year, and what are their treatment options?
So for metastatic HER2 positive breast cancer, one of the things that we're looking at in this trial is de novo. So de novo means that at the time of diagnosis, you already have metastatic disease. That's actually pretty rare. Most of the women that we see are diagnosed with early stage breast cancer, meaning that the cancer is still contained within the breast and has not spread to other parts of the body. Or we sometimes see women who had early breast cancer that was treated and then many years later can come back as metastatic disease. So we call that recurrent metastatic disease and not necessarily de novo. So to present with de novo and be metastatic up front is pretty rare. We see it in about 5, maybe 10% of women. And HER2 positive breast cancer is also more rare. The majority of breast cancer that we see is hormone positive. That represents about 80% of women with breast cancer. And HER2 positive breast cancer is probably 20%, maybe a little bit less than that. So this is a pretty rare population that we're talking about, but we are seeing a rise in it, especially in younger women over time. And part of that is we have much better screening. So we're picking up a lot of women with very early breast cancer. And so we're actually, as a result of that, also seeing more women presenting with metastatic breast cancer that we probably would have missed in the past.
What's the primary purpose of registry trials?
Yeah, so registry trials are actually very helpful because they really represent real-world data. So when we plan a clinical trial, there's very specific criteria about who can participate, and you usually have to be very healthy, not have a lot of other medical conditions in order to participate, and you usually have to be young, and you have to be able to travel to a place that is performing that clinical trial because there's probably extra visits, extra blood draws, there might be extra biopsies and other procedures that need to be done. A registry trial is just following patients that are getting a type of treatment, and it can be done anywhere. So for example, our trial is an online registry trial. So all of the information is collected online. So nobody has to travel anywhere. And there are really no criteria for participating except that you have to have the specific type of oligometastatic HER2 positive breast cancer. So we're really interested in seeing in the real world when people are not the model patient, they might not be as healthy, they might have other health conditions, how they do with the treatments that we're using.
What do you think makes your registry trial stand out from the others?
So we're really hoping that by having it online, we can have a much more diverse patient population that can participate. So we're really hoping to get a lot of community practices all over the country because hopefully there will be less barriers to participating. And we have a research coordinator who can help to enter the data. We have very short surveys to complete. So we're really trying to make it as least bothersome as possible. So we know that physicians are busy. We know that patients are busy. And so we try to make it short, take the least amount of time, but really hope to involve everyone. We know that there are differences in how people practice across the country. We know that there are also different patient populations. So, the ethnic makeup and the socioeconomic makeup is very different from one community to another. And we're really hoping to kind of get a much more diverse patient population and include everyone to see how different people from different backgrounds are doing on the same treatment regimen.
How did you recruit patients?
So this is still ongoing and it actually just started. So we're actively recruiting patients. And one of the main ways is we're trying to get the word out to community oncologists and patients as well. So I have two wonderful patient advocates that are working with me on this trial, Christine Hodgden and Kelly Shanahan. And they have tweeted about it and let their organizations know about it. So hopefully patients are hearing about it and can discuss it with their oncologist. And then also just reaching out to oncologists through newsletters, through the web, and actually Twitter has been an important component as well, because a lot of patients are on Twitter and a lot of oncologists are on Twitter as well.
Can social media become a recruiting tool?
I think so. And I think actually it can be a very helpful recruitment tool because I think there's fewer barriers to patients having access to it. We know that a lot of our patients are on Twitter. A lot of them have found helpful support groups where they talk about symptoms and suggestions for how to manage their treatments. And I think it's a great venue to find out about clinical trials too. It doesn't have to be just registry trials. And you might not necessarily hear it from your oncologist, but you might hear about a trial from a fellow patient. And maybe it happens to not be in your neighborhood, but maybe you're willing to travel. And so I think it will really open up kind of what we consider as eligible patient population for our trials. And the more diverse the patient populations that are included in these trials, the more accurate they're going to be and more reflective of what we see in the real world.
Why are clinical trials so important for this patient population in particular?
So the de novo oligometastatic patient population, as we talked about, is especially rare. And so they often get left out or lumped together with other groups in clinical trials. And the reason why we think it's really important to study this patient population is because the biology is probably a little bit different. So unlike recurrent breast cancer that has already seen some kind of chemotherapy or some kind of treatment, those cells are more likely to be resistant because they probably, microscopic cells probably grew through the previous treatment. And so they're going to be more resistant to other treatments going forward. When it's de novo, it means that they haven't seen any treatment yet. And so those cells are probably going to be more responsive. And the fact that it's only spread to just a couple of places and not all over probably means that that cancer is a little bit less aggressive and might be more responsive to treatment as well. So this is a really special population of cancers that might be uniquely responsive to treatment. And then the other thing is that for HER2 positive breast cancer, we've just had so many advancements in the past couple of years. We have these amazing targeted antibodies that target that receptor. And now we're seeing what we call antibody drug conjugates, so antibodies with chemotherapy attached. And so the systemic treatments are becoming much more targeted. There are fewer side effects. They're better tolerated. And so we can be a little bit more aggressive in what we're giving in terms of systemic treatments probably with less toxicity. And so we're very interested in seeing how these patients do because the drugs for them are just so different compared to decades ago when some of the previous trials were done.
What does survivorship look like?
So, one of the really important things that we're doing in this study is, in addition to following kind of the clinical outcomes of how the patients are doing, we're also sending them a survey every 6 months to measure their quality of life. And really, quality of life is one of the most important things, especially in the metastatic setting when most of the time we cannot cure the cancer and it's going to be a long-term lifetime treatment. So we want to make sure that what we're doing is not preventing them from doing the things that they enjoy and is not negatively impacting their life. And it's something that's hard to study and that a lot of clinical trials end up leaving out because of cost or because of logistics. And so it will be really interesting to see how the quality of life is affected, at least through these surveys from these patients that are getting a treatment that's a little bit more aggressive than the usual standard of care. And so talking about how these patients do, a lot of our treatments can affect a lot of things that can negatively impact their day to day. A lot of chemotherapies can have neuropathy, or there might be tingling or numbness. Some of our treatments can affect the heart, which is very important and might limit how much they're able to exercise, how much they're able to do in terms of activity. So there's a lot of things that are really important to monitor and to make sure that we're not negatively impacting by giving patients too much treatment.
What are some of the challenges you've faced enrolling patients in the trial?
So I think one of the big challenges is that it's a rare patient population. And so small practices and even academic centers are just not going to be seeing that many patients per week or per month. And so it's really important to kind of cast a wide net to catch these patients. And I think the other challenge will be we know that in most clinical trials, a lot of academic centers are kind of overrepresented because they're well known, they have the reputation, that's where patients come for trials. And so it will be really important to try to get patients from all over the country, not just academic centers, not just the East Coast, not just the West Coast. We're really hoping to get really as most of the country as possible and to really capture what is happening in small practices that are in the South or the Midwest, other parts of the country that maybe might not be as well represented in the national trials that we do.
Are there benefits to having patients from across the country?
I think it will be so crucial to include those patients. We know that there are small differences in how surgeons do surgery and how radiation is done. Sometimes different institutions have slightly different equipment. And so even though we try to standardize everything as much as possible, it will be really interesting to see kind of how practice differs a little bit across the country. And if it doesn't, that's wonderful. That will show that we really do have standardized care across the country. But we also know that patient outcomes will probably be a little bit different. There's a lot of evidence that shows that socioeconomic background and ethnic background, unfortunately, and access to care, all of these things affect how patients do. And so it's really important to try to capture that. And the only way to do that is to try to get those patients to participate who are in the part of the country where maybe they don't have as much access, where maybe they do have to travel 2 hours to see a doctor, which probably negatively impacts their outcome.
What does this trial mean to you?
I think it's just a wonderful opportunity to try to increase our knowledge. I think a lot of what we do in medicine is based a little bit in tradition. A lot of it is based on evidence, but this group in particular is a group that's just very hard to find, and we honestly just don't have that much evidence about what should we be doing with this special patient population. And I think what we're doing so far is based on what we've been doing all along, and maybe it's time to rethink that and to get a little bit more creative, and also to take a really close look at how toxic are our treatments. Are the newer treatments better tolerated? What kind of side effects are patients having? And how is it affecting how long they're living and also how much they're able to enjoy their life during the time that they're living. So for me, this is just an amazing opportunity to be involved in this research and to hopefully change how we think about oligometastatic breast cancer.
Thank you, Dr. Rozenblit. You can take a look at the show notes for a link to the registry study and more information on this rare form of breast cancer. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.